Here's everything that you need to know about treating hives that are related to COVID-19 from the perspective of a double board certified pediatric allergist immunologist. In my practice, I have been seeing a lot of patients after getting COVID-19 and developing chronic daily hives that have lasted for months, if not years in some cases. And that can happen in kids and adults. In fact, I saw 3 patients yesterday, age ranges of about 10 to 55, who were dealing with this. Even one patient was dealing with hives after getting COVID about a year and a half ago. Why is this actually happening? We don't fully understand at this time, but we know that COVID-19 can induce immune dysregulation, which could be mast cell activation problems, and that can vary in all sorts of different types of symptoms. The mast cell is a part of your immune system that helps protect you from certain types of infections like parasites. It helps protect you against venom. It does a job with wound healing. It does all sorts of things, but it's also considered to be like the allergy cell of the body because it can release lots of histamine, which is the chemical that can cause a lot of different issues, including developing hives or swelling. So COVID-19 could induce chronic mast cell issues, including chronic hives. The triggers for this type of mast cell activation varies from person to person, but the 2 most common types that I've been seeing lately are individuals who will get hives after having an elevation in their body temperature, like with exercise or sweating, or if they simply scratch their skin, it can induce a hive right along the area that they scratch. We call that dermographism or skin writing. Those types of processes are chronic, and we don't know how long they will last for in patients who get COVID-19 and develop chronic hives. So unfortunately, we don't have any tests that can tell us how long that'll last for. In terms of treatment, if we can identify those triggers and try to reduce exposure, that can be helpful. And after that point, we think about medications to help block the generation of hives. So that's mainly in line with different types of antihistamines, and leukotriene receptor antagonists are the main types of medications that you start out with. And the amount that is prescribed varies from person to person, so you need to talk to your doctor about that. Sometimes we have to use systemic steroids like prednisone to help, or if it gets severe enough, I have prescribed patients omalizumab, which is a type of biologic lab-grown antibody that can help stabilize the mast cells, so to speak. I hope this type of information is helpful for you. There's a lot more details that go into this, and I'm happy to answer questions, but feel free to follow for more information.